Okay, Elana from Miami. All right, so you went through the ketamine coma procedure. That was back in February of this year. And now today's date is December 15th, 2010. And so we're now, what, nine months roughly out. I saw you about 2 months after the ketamine coma procedure. And since that time, you've undergone 2-hour ketamine infusions, about 2 hours each. Earlier today, we talked about, I think you would benefit from it instead of just going under 2 hours, but going for a 4-hour infusion. And the reason is the benefits are not just from getting the dose up, but holding it up over a period of time. And if you do the measurements like pain thresholds, you can see improvements with a longer duration of exposure to the ketamine. Now, there's some other things that have been going on here with you. You had some exacerbations in that right upper extremity. I hope I got that correct. Right? Correct. Mm-hmm. And you had a stellate ganglion block, which seemed to help you.
For the left.
I'm sorry, the left side. I thought I had that wrong. Okay, it's for the left side, and it did help. So, point is that there are more than just one modality besides ketamine. Now, you had those 15 2-hour infusions, and they did help you not just for days, but actually for weeks, correct?
Mm-hmm.
Okay. So the ketamine is also part of the armamentarium here. And also, as you've learned, because you've had some re-injuries since your ketamine coma, that's one of your worst enemies, right?
Yep.
And also stress can really wreak havoc.
Yep. And
you're trying to be rehabilitated after a ketamine coma. Now, good news, you're off your narcotics, you're off the opioids. And again, when you re-injured yourself, you took them, and that's very appropriate. You have to do that to control your pain, okay? When the non-steroidals don't work, that's a very appropriate thing to do, because if you don't, it sets off the RSD. Okay, now, I think we covered everything except there's an issue pending here with regards to your immunological system, okay? And we talked about, I just don't have enough facts. I don't have enough information here from a laboratory standpoint to draw any conclusions, and I know you're in the process of researching that out yourself, right. So I'm not going to comment any further than that on it, okay? Mm-hmm. I think we covered the important things. Right. Oh, yes, right. When you left last time, and because you had set off the CRPS in that right upper extremity from IV sticks, we recommended putting a port in. You have a port in. We talked about how to place it properly, making sure that when they insert the Huber needle in there, they actually make contact with the backside of that thing. It's metal, and make sure that it's inside. And just get somebody that does this, on a routine basis. Don't have somebody that just is trying it out for the first time. You people can't afford to be traumatized by multiple needle sticks, and that was the whole idea behind putting it in the first place. The second thing is that when they go to put it in, just clean it down with alcohol and put a little bit of local anesthesia on there, local anesthetic like lidocaine, and that'll make your life a hell of a lot better. Okay? All right. And of course, the obvious thing is, the most important thing, if they're going to draw blood or they're going to get blood, you better use heparin to flush it with. Okay? All right, that's the important stuff. By the way, I looked at it earlier. The port looks great. Looks like it's in good shape. Now, let's go through some exercises and see how you're doing. Okay, we're going to look straight ahead. Don't follow me. I'm going to go off to the side here. Look straight ahead. Okay, put the vertical finger test, 2 vertical fingers in your mouth. Okay, now, can you do that, or are you getting in there vertical? You got them in vertical? Okay, good girl. Good. Now, question. Do you having pain when you do that?
Just some tightness.
Tightness in there. But it's nothing like it was before the ketamine coma. Am I correct on that?
Correct.
Okay. Take that right hand behind your head, please. Are you having pain when you do that?
Minimum.
Minimum. Okay. And of course, that was major before when I saw you. You had that IV stick, remember?
Right.
Yeah, okay. Now go ahead and take the left side and do the same thing. There you go. Good job. Good job. How about the pain there? You having pain when you do that?
Minimum.
Minimum? Okay, good. Next thing I want you to do is I want you to take that right hand out in front of you. Open and close as fast as you can. That's good. Good job when using your thumb. That's good. All right, now do the left side, please. Fast as you can. Good girl. Looks like you got pretty good control there as far as I can see. Okay? Now, the next thing we want to do here is I want to go down to your feet. And I want you to go ahead and rotate your ankle. Okay? Start on the right, please, if you don't mind. We'll do the hard side first. Rotate it as best you can. Atta girl. Good job. Good job. Okay, wiggle your toes if you can. Okay? Hitchhike back to Miami. Can you do that? Can't do it. Okay, that's
Yeah.
okay. That's fine. That's fine. Okay, you tried. You did what I wanted you to do. Okay, so we're not going to go any further than that. Now on the other side, the good side, the better side, rotate your ankle, please. Atta girl. Wiggle your toes for me. Atta girl. Hitchhike back to Miami. Okay, there you go. All right, next thing we're going to do here is we're going to see how you can get up, and your husband's going to stand by your side to spot you for safety reasons. Okay. Atta girl. There you go. Yeah. And I want to see if you can put any weight at all on that foot as you walk over to the threshold of the door over here, please. Really difficult today. I got you. And I think you were telling me earlier today that you're kind of in an exacerbation state right now with your RSD. Am I correct on that? Yeah. So this is not one of your better days. That's fine. Okay, turn around and face me. I think we got a pretty good idea what's going on. Now, if I ask you to take a couple of steps on your toes toward me, is that even possible?
No.
Well, let's do it this way. How about your heels? Can you do heels?
Maybe. No.
You can't do
maybe,
it?
Maybe.
Well,
Touch.
the point is I don't want you to do something that's risky.
Because of the
right.
re-injury.
All right. Well, we'll try one more test on you, okay?
Okay.
You see that black stretcher over there?
Mm-hmm.
I want you to leap from where you are onto that stretcher. Can you do that?
No.
Oh, come on. Have a seat. All right. There you go. All right. Now, let's talk about a treatment plan going forward here, okay? In your situation, we're going to get back to the fundamentals. The fundamental is you've got a huge problem in that right lower extremity in terms of weight bearing. You need to get in the water as best you can tolerate 3 times a week. Heated pool, we talked about that extensively last time, okay? Good for you. Good girl. Good girl. And that's probably the single most important thing that's going to get you better. The other thing is trying to manage your stress as it relates to all this, okay? And we also talked to your husband earlier about documenting, as we did today, her function using a video camera maybe once every 2 months.
Okay.
She needs that as a reference standard. And of course, I'd love to. You bring it along. These videos only run for 5-10 minutes, so it gives me a pretty good idea what's going on with you. Now, the other thing here, thank God you're off those high doses, huge doses of narcotics. That's wonderful. That's great. Congratulations on that one. That's a that's a huge accomplishment on your part. Now, I'm going to leave it up to Dr. Schwartzman and others to look at this whole immunological issue and get back to you with more information on that. Other than that, obviously ketamine infusions are a benefit to you, no question about that, as needed. And we talked about how to best judge when you need one. And the second thing is sometimes a sympathetic block can do lots, like it did in your situation, to help you with your left upper extremity. So these are things not to forget about. It's a multimodality approach, both emotionally and physically, okay? So let's turn over here to your husband and see if he has any questions about any aspect of this.
Nope. I think we've covered everything and more today.
Right. So this has been a long haul for you. You know what I mean?
Well,
What do you think? Is it worth it?
today we're better than we were 12 months ago. That I'm
Exactly.
positive of.
Yeah, right. And you know what? We got videos to document that, don't we?
Absolutely.
Yeah. How about you, Elana?
Long haul.
Long haul?
Slow.
Right. Yeah, it's a rehab process.
Up and down.
Up and down, roller coaster.
Yep.
You're not living in a bubble, so you're going to have these ups and downs. Bumps in the road, as we say, okay? Do you have any questions for me at all? Anything?
Nope.
Okay, very good.